Hi, my name is Mike Schnabel. I'm an orthopedic surgeon here at BayCare Clinic. One of the main questions people have after a total joint replacement is how long am I going to be in the hospital for? And that's starting to change. When I was in training, it was often 5 to 7 days. But nowadays, the length of stay has come down significantly. For a hip replacement, the average is 1 to 2 days now. And we're even starting to do some as an outpatient. With the newer anterior hips, the incision is smaller, the recovery is much faster, and there's much less pain. So in the right patient, someone who's younger and doesn't have much for other medical comorbidities or other medical problems, we're able to start doing those as an outpatient. Knee replacements, if you talk to anyone that's had knee or hip replacements, the knees are a lot more difficult to recover from, both pain-wise and in terms of the need for therapy. So knee replacements, we're still at about 2 days for length of stay. We occasionally get someone who's able to leave the hospital after 1 day, but 2 days or even sometimes 3 days is more appropriate for full knee replacements. Now, a partial knee replacement is certainly much easier. Those we're actually starting to do as an outpatient as well, and that's becoming more of a trend nationally. So for a partial knee replacement, again, if it's a relatively healthy patient, we're able to do those as an outpatient. Otherwise, that's usually just a single overnight stay. One of the big questions I'm faced with from patients when we're discussing a joint replacement is how much pain am I going to have? That's everyone's main concern, and that's certainly something that we are dealing with patients. This is a very difficult problem after joint replacements. Our options for pain relief have gotten much better though. Our anesthesia team has been very good at keeping up with the latest nerve blocks, and we've just started doing one here recently for knee replacements that's made a huge difference. Traditionally, we've done a femoral nerve block, which is blocking the nerve up in the groin, high up in the groin here, and that takes care of most of the pain in the front of the knee. But the downside is it would wipe out the quadricep muscle, so you'd have a very difficult time standing on the leg. It would feel like you couldn't trust it, or it would give out easily. There's a newer type of block that we've started doing that is still blocking the same nerve, but further down the thigh. So you still get the pain relief, but you're able to walk on it, don't need any bracing or anything. It's made the recovery much easier. The therapists love it because people can participate in therapy, and the recovery is just much quicker. And again, people go home much quicker with this newer type of block. So the pain options have gotten much better thanks to our friends in anesthesia. We're also doing different medications before the surgery and after the surgery than we traditionally have. We're starting to get away from narcotics, which can cause a lot of problems for people. A lot of people just feel like they're kind of in a fog after these big surgeries from the narcotics. We also see a lot of people, and particularly our older patients, that have issues taking narcotics in terms of constipation or can't go to the bathroom, whether it's urination or having a bowel movement, they struggle. And sometimes that requires them to get a catheter or a longer stay in the hospital. So we're getting away from narcotics and using more higher dose Tylenol and other non-narcotic pain relief options that work pretty well and don't have near the side effects that we see with traditional narcotics. After joint replacements, there is a significant need for physical therapy, in particular with knee replacements. We don't need quite as much therapy with a hip replacement, but the options for therapy, we actually prefer if you go to therapy as an outpatient. That way the therapist has all of their normal equipment at their disposal, and I think the therapy is much better. For people that are having a little bit tougher time recovering and don't want to have to leave their home, we can certainly arrange for in-home therapy. And that works very well as well, and that usually goes for about 2 to 3 weeks. And then patients are mobile enough to get out and start going to outpatient physical therapy. Another concern people have after a joint replacement is how independent will I be and do I need help at home, which is a good question. And that varies obviously by how active a patient is going into the surgery and with their particular recovery, how well they deal with pain and with therapy. But for most people, after a knee or a hip replacement, they're on crutches or walker for 7 to 10 days, and then after that maybe a cane for a short period of time. And again, that varies significantly. I've had some people that never used a cane at all after a hip or knee, but that's a rare exception. For most people, if they can have a person at home to help them, certainly the first week, sometimes 2 weeks, it's much easier. Now, we do a fair number of people with a hip or knee replacement that live alone and don't have anyone that can help them. And with some of the newer techniques and the less invasive surgery that we're doing, even those folks that live alone are able to go home and get by fairly well by themselves. Those are oftentimes people that will have in-home therapy for. A lot of these questions that people have regarding do I need help at home, or what type of help do I need at home, are answered in our joint camp. And that's something that we offer every patient before the surgery, and they can bring a loved one or a care provider with them.